So here we are. This used to be the entrance to the minute emergency room. You know, emergency service are no longer available at this site.
Sometimes you see anger in people, but that's a manifestation of people being afraid of what happens when they have no emergency department available.
If we don't change course, we're going to have more people showing up in emergency departments dead, dying en route to the next available hospital. That's one death too many.
Right here, that used to be where the red sign was, said emergency department this way. This was the entrance.
As Canadians, we're all proud of our universal health care. Now, one of the reasons is the idea that no matter who we are or where we are, anywhere in the country, we all have the same access. But there are more and more emergency department closures in small towns all across Canada. Is our health care system truly universal?
First of all, I want to say thank you to all of you for joining us today.
The community centre in Minden, Ontario is packed. This is what happens when the unthinkable takes place. The emergency department in this town of 6,000 people just closed permanently.
I'm always going to refer to everybody and everyone from ourselves, from the county, and all our neighbors that we are one huge family. And that's what we're fighting for.
Patrick Prozuchek had never protested anything in his life, but now that's all he does. He put his regular life as a contractor on hold the moment Minden's emergency department closed.
It's a death. And there's no other words to really describe it. It honestly feels like a death to the community.
People are gathered here today to hear a proposal to open a clinic where the emergency department used to be. But the clinic would only be for non-life-threatening issues.
Right, like if we're providing care to you, we are allowed to draw your blood. To also
Marina Hodson is the executive director of the local family health team, and she knows the clinic isn't what people really want.
And unfortunately, I'm not in a position to provide an emergency department. I work in primary care, so I don't do emergency care. I don't do hospital care.
The reason the emergency department closed permanently here is the same reason for the hundreds of temporary closures all across the country. Since the pandemic, there aren't enough doctors and nurses to keep things running. Dave Hammond tells me his town is in crisis.
We're hopeless. We don't have a walk-in clinic, and we've just lost our emergency room. People are scared, not just me, but we want our emergency room back.
None of us are going to give up hope. Hope is what we need. And I just want to thank every single one of you in this room for all your support and being here today and being involved, because that's what we need to have with our family health care here in Minden. Right here, look, say hi.
At the end of the meeting, I learn why this fight is so important to Patrick.
My daughter, who just turned 7 today, has this uncontrollable arrhythmia that can go in a blink of an eye in this very fast-paced heart rate, and there's nothing we can do unless we have medical intervention. Did they sing you happy birthday today?
No.
No.
There wasn't enough time.
Kinsley's been taught techniques that usually control her condition.
Did your heart act up at school today?
Yeah.
Yeah. Did you have to do your little maneuvers?
Yeah, I had to do 12.
You had to do 12 of them?
Yeah.
You know, as a parent, it scares the hell out of me for my daughter. When she cries to me at nighttime and says, "Daddy, now the ER's gone. What's going to happen to me the next time I go into arrhythmia and we can't stop it? My daughter going to bed." Those are the things as a father I have to worry about every night. And that's why I fight so hard today.
Patrick refuses to accept that now, if something were to happen, it's a 30-minute drive to the closest emergency department. And that's the new reality in many towns across Canada. There's a crisis in emergency medicine coast to coast. 160 temporary closures in Ontario in the last year alone.
Just climb up there, John. I'll have a look. Okay.
Dr. Alan Drummond has been an emergency doctor in Perth, Ontario for 40 years. And last summer, for the first time ever, his department had to shut down because of a shortage of nurses.
You know, I'm a community guy. I love this town. And I felt we'd let them down. And I was having a hard time going to the grocery store because I thought, you know, I was ashamed. I and our emergency department staff and our hospital had left them vulnerable unnecessarily.
Now, the reason I wanted to talk to Dr. Drummond is that he's made it his life's work to figure out how best to deliver emergency medicine in Canada. We're coming from towns where people are worried, people are upset. What's your message to them?
I have empathy for their situation, but there's a new and harsh reality that people have to accept. We just don't have the capabilities to provide a full-service emergency department to every small town in Canada. Not going to happen. Just look straight ahead for me.
Dr. Drummond understands that people in rural Canada aren't going to like his message.
We need to look at another way of doing this, which is focusing on regional centers of excellence where the drive is not too far to facilitate reasonable access. Half an hour, 40 minutes. And what a community loses in convenience, they would gain in expertise, an enhanced level of service in the next available community. Reasonable, timely access to quality emergency care. That's the issue. All right, well, good to see you, buddy. Thank you.
Losing convenience and gaining enhanced care seems like a positive trade-off. But tell that to the people dealing with the closures in their town. Take Chesley, Ontario, for instance, a town of just under 2,000 people. Here, the emergency department closed for about 55 days in 2022, and now it's only open from 7 a.m. to 5 p.m. Monday to Friday.
Today is a 6-month anniversary of when we started a committee to try and help save the hospital.
In this church basement in Chesley, people are fighting back. Sharon Musel is a retired nurse.
That's good?
Yeah.
Okay. What I see in the town is people are afraid. It's very scary to know that after 5 o'clock, I think a lot of people look at the clock and know it's 5 o'clock. Okay, where am I going to go if something happens?
The people here want me to know that emergencies happen at any time. Meet Krista Klagas.
I've taken kids to the emergency department for scarlet fever in the middle of the night. When you're a single mom, it's a long trip. There's people in our community who need this emergency room. We have seniors, we have single parents.
Dr. Adam Winterton explains how precarious the situation is.
Small hospitals are all kind of one physician away from a crisis. Why would a young doctor go to a place that's already in crisis?
The fear here is that the temporary closures are just the beginning. And if the shortage of doctors and nurses continues, the Chesley Hospital will close permanently. Where do you think your town would be, Chesley would be, if the hospital does close?
I really don't know. It scares me to even think about it, and that's why we are fighting so hard for what we believe and need.
Nathan Rohde is the local funeral director. He grew up in Chesley, and it's as if for him, having a local hospital is part of his identity.
It's impossible for me to think of our community without our hospital. It would never be the same again if we were to lose it. Whether you're in small town Chesley or anywhere else across the province, we have the same right to that health care, and we should not be penalized for being in a smaller rural community.
And that's what this fight is about, universal health care as we know it. Because losing something you've always had, like your emergency department, can shake us to the core.